Hello everybody, my name is Kortney Bush. I'm a second-year audiology student at the University of Texas at Dallas, and I work in the Hearing Health Lab. Over the summer, Dr. Linda Thibodeau and I did a pilot study for the evaluation of a protocol for virtual testing of speech recognition and noise when using the Live Listen feature on the iPhone. I just wanted to say thank you all for attending my presentation virtually, and thank you for your attention in advance. So we know that people with hearing loss often have trouble in noise, and the greater the degree the hearing loss, the more difficulty the person will have communicating with others, especially in the presence of background noise. Just for more introduction, smartphone-based applications currently exist that improve the signal-to-noise ratios, such as the Live Listen feature on the iPhone, and as a result of COVID-19, really global connectivity and access to services from a distance is really just more important than ever. So for some background work, Dr. Swainpool and colleagues have investigated the validity of offering audiometric testing remotely, and they found that no significant differences exist between face-to-face audiological evaluation and remote audiological evaluation. But really, little is known about the treatment outcomes for virtual oral rehabilitation, and specifically the use of remote microphones and smartphone applications to improve communication. So for some additional background information, Live Listen is actually a pre-installed setting and feature on the iPhone that works to increase the signal-to-noise ratio. It uses AirPods and it pairs them to the iPhone. It can only work when the AirPods are paired to the iPhone. And this also actually works for hearing aids. I just thought that was important to note. So what it does, AirPods are wireless earbuds that sit in your ears, and they have microphones on the outside of them that bring in some sound for situational awareness, but it still lets the direct signal in. It picks up the signal from the microphone on the iPhone, and the signal is then routed to the AirPods. So you still get that situational awareness around you, but your ears are plugged up, so it attenuates some of that noise, and it puts the signal directly close to your eardrum. For today's study, we wanted to provide a foundation for future research and virtual access to oral rehabilitation services, and we also wanted to facilitate ongoing collaboration with the engineering department regarding development of smartphone applications for people with hearing loss. We had 10 participants, age range 21 to 25, with inclusion criteria being normal hearing, Apple AirPods and an iPhone, and a Mac computer. The equipment used was a personal MacBook laptop, personal AirPods, personal iPhone of our participant, and then we met via WebEx. WebEx had to be installed on the MacBook before, and they were given instructions to do so via an email before we met. We also used an Amazon 7th generation Fire tablet, and we took COVID precautions when mailing this to each participant. This is an image demonstrating how this was set up. We adapted this from the Rebecca Havens 2020 smartphone project. I just wanted to give her some credit. And essentially what we had the participants do was set their laptop up 3 feet in front of them and set the volume to half volume. And then we had the Amazon Fire tablet 3 feet behind them with the speaker facing the back of their head set to full volume. We then met via WebEx, and I was on my side of things playing hint sentences from my laptop, and I had the participant repeat them. So our stimuli that was used, we used hint sentence lists, and we presented them from the laptop at full half volume, and then we had classroom noise file played from the Amazon Fire tablet at full volume. There were 2 testing conditions. Our first condition was a no technology condition. We had the participant repeat 2 hint sentence lists without any Live Listen technology, so no AirPods or phone. Nothing was in their ears. They were just listening to the noise behind them and repeating the hint sentences that were played at half volume in front of them. Our second condition was the Live Listen condition, and we had them play 2 hint sentence lists and repeat them back utilizing this Live Listen feature. So we also had them put their smartphone in between the 2 speakers with the microphone facing the speakers and their AirPods in their ears. We had them adjust the live listen condition to the most comfortable listening level. All of our participants were conditioned with one practice sentence list to ensure that the volumes were set to the appropriate levels in order for calibration issues that may have occurred. If this was too difficult, then the participants were instructed to turn the volume up on their laptop. One participant actually got 100% of the practice list, so they had to turn it down one click. 4 out of the 10 participants total adjusted the listening intensity. The participants were instructed how to set up the testing area. Additional instructions were given if the participants had never heard of Live Listen or did not have the feature enabled on their phone. All of the participants were conditioned with one practice list or additional if the task was too difficult, and they were told to repeat the sentences the best that they can and guess if they were unsure. What we found, if you look on the y-axis, is the percent correct, and at the bottom is each condition. The black outlined bar with the white space is the no technology condition, and the solid black bar is the live listen condition. So across all of our participants, you can see that there was a significant difference in the live listen condition and the no technology condition, with the better performance being the live listen condition. The no technology condition mean was 46.4% and the live listen condition mean was 96.3%. All of our listeners actually performed better in the live listen condition, whereas 90% of the participants reported that they preferred the live listen condition over the no technology condition. 90% of participants also reported no prior knowledge of the live listen feature on their phone. So again, as this was a pilot study, our preliminary data show a possible pre- and post measurement for virtual rehabilitation. Additionally, this shows that oral rehabilitation may be more accessible for patients virtually during this COVID pandemic, but further research should really be completed to assess how effective oral rehabilitation is virtually. Again, thank you all for your attention to my presentation. If there are any questions, you can email Kortney.bush@utdallas.edu as listed on the screen, or Linda Thibodeau at tib@utdallas.edu.